Good evening, and welcome to the first in a series of Healthcare for All virtual town halls. We are thrilled to be offering the first town hall from right here in the Mid Ohio Valley, with others to follow in various locations across the state. We appreciate you taking time out of your busy schedule to join us tonight. We hope this discussion will prove to be not only informative, but also thought provoking and interactive as well. It is your input that we value, as it is the major determinant of what we as a coalition dedicated to the vision of a healthier West Virginia will fight for. And we hope that you will fight with us. I would like to acknowledge our hosts for this evening's event: West Virginia Citizen Action Group, Healthcare for All, West Virginians for Affordable Healthcare, Healthcare for All Wood County, the West Virginia Center on Budget and Policy, and the Circles campaign of the Mid Ohio Valley. Once again, welcome. I'm Lisa Doyle Parsons, Executive Director of the Circles campaign of the Mid Ohio Valley. I am part of this campaign because I believe that everyone should have the ability to access quality health care. I'm going to have the other speakers introduce themselves now.
Amber, can you?
Hi, my name is Amber Roberts, and I am the coordinator for Healthcare for All Wood County chapter. Healthcare affordability is very important to me and my family because currently I work two part-time jobs and don't have access to healthcare, and that is what brought me to be a part of this campaign. I'll now introduce you to Savannah.
Hi, I'm Savannah Lyons with West Virginia Citizen Action, and we're one of the other core partners of this campaign. And I am so excited to be here today because I love to help people find their power, and I believe this is a campaign that allows us to use our power to become healthier and to stand up for our rights to healthcare in West Virginia. So thanks for being here, and appreciate you watching. And I wanted to hand it over to Lisa to introduce herself.
For affordable health care. And I am part of this campaign because I believe everyone deserves health care. Welcome, everybody. Can you hear me now? I'm going to pass it on to Kat Stoll.
Hi everyone, my name's Kat Stoll, and I'm with West Virginians for Affordable Health Care, and I'm a policy wonk, and I'll be telling you a little bit more about some policies later in the call. Thanks for joining us. It's really great you're here.
Thanks, Kat. I'm excited to talk about this campaign and why we're here today. But first of all, while you're listening, I just want to invite everyone to take our Healthcare for All poll. And if all the other speakers can mute themselves, please. Thank you. So we've got this poll, and we're going to be giving a little prize after this live stream is over for some lucky person who is going to take this poll, and they're going to win the drawing and get a $15 gift card. And this is the way that we're finding out from you what you would like to see change about the healthcare system in West Virginia. So I think they're going to put up the URL on the screen, but I'm going to show it to you again. So it's tinyurl.com/H4A poll. H4A is for healthcare. I'll do that again here in a bit. But don't forget to take that because we'll have a drawing later tonight. And but my job today is to tell you what the Healthcare for All campaign is all about. And for me, it's about making healthcare more affordable and accessible for every single West Virginian, regardless of who they are, whether they're rich or poor, whatever their race, class, age is. That's what this is about. And it's about valuing people over profit in the healthcare system. And we believe healthcare is a human right. And we believe in a world, we know that a world is possible where everybody gets the care they need. So we're pushing for a bold agenda of changes at the state level to help us get there. And it's going to take all of us to make this happen. And it's going to mean a lot of things. It's going to mean listening and talking with our neighbors. It's going to mean telling our personal stories. It's going to mean meeting with our elected leaders all year round and telling them what we need, reminding them that they work for us. It's going to mean telling our personal stories. It's going to mean holding candidate forums. It's going to mean getting candidates to say out loud that they will stand with uninsured people, people using Medicaid, and all of us who are struggling to afford what we need. And it's going to mean showing up at the Capitol, and it's going to mean showing up in our communities. And it's going to take you and me and every last one of us. So that's what this campaign is about, is to take the fight for affordable healthcare to the people and bring the people to the folks in power so that we can get a system that really does cover every single West Virginian. And so I'm proud to be part of it, and I'm grateful to you for listening today. And I'm going to turn it over to Amber, who's going to talk about the local work that we're doing in the Mid-Ohio Valley.
Thank you, Savannah. Hi, and welcome once more. My name is Amber Roberts, the coordinator for Healthcare for All Wood County. And I run the Facebook page, which is Healthcare for All Wood County, which is where you can find us. With health, it has a lot of healthcare information and updates to our agenda, as well as any upcoming events, advocacy days, and things like that will be available on our page to keep people involved, educated on all healthcare issues. In light of the COVID-19 pandemic, we recently completed a phone banking session where we were cold calling West Virginia residents of Wood County to get input on our healthcare agenda, which I believe went very well. We also asked participants for survey feedback from those individuals, as well as providing the survey on our Healthcare for All Wood County Facebook page. For any of you with us today that took the time to take that survey, I wish to personally thank you. I will now hand it back over to Lisa Doyle. Thank you.
At this point, I would like to share with you a little bit about how I became involved with the Healthcare for All campaign. Through my work with the nonprofit circles, it became blaringly obvious that those with lower incomes frequently have poorer health outcomes. It became obvious that poverty equals poor health. Though my work did lead me to initially engage with the campaign, it was something a lot more personal that has kept me engaged. Let me start by sharing a little bit more about myself, and let me introduce you to my family. I am the youngest of 6 children. I'm the only girl in the family, and as I said, the youngest. I have 5 older brothers. This is my brother, Bob. And this is Bob and I at my college graduation. He has always been my hero. He has always been someone that I can look up to. He bought me my very first car, and it was a '79 Cadillac Sedan DeVille. And he taught me that it was okay to believe in God, even when others around me did not. Next, let me introduce you to my brother, Scott. Scott and I are closest in age, and he is my best friend. He calls me at midnight or so, 1 in the morning, just to check on me and see if I'm doing okay, or if he feels like talking. He always knows that I'm a night owl and I'll be up, so I'll be there to answer his call. So here we are in our younger years. He was an arm wrestler as a hobby, so he's looking all buff. And then this is Scott on the day of his oldest son's wedding. Soon after this event, the wedding, he would be waiting for the birth of his first grandchild, a boy. And man, is he ever excited. Next, I want to introduce you to my brother, Tim. And most of those that know Tim, they really call him Fritz. He has been called Fritz since childhood because he used to deliver the Grits newspaper. So they would say, "Here comes Fritz with the grits." He's a good old country boy, as I'm sure you can tell by the picture. And he is that brother that is always the silent supporter. You never have to explain any problems or issues to him, but he is there for me at all times. This is a picture of my brothers all together at work. They own Doyle Drywall in Stanfield, North Carolina at this point. They left West Virginia in the late 80s on the Hillbilly Highway for better job opportunities. They have always worked together in some capacity since about age 14 on up. Well, these were my brothers. Unfortunately, they are no longer here. My brother Bob found out in 2009 that he had COPD. He died within a year of being diagnosed. He was 53 years old. My brother Scott left us next. He had sleep apnea, but it was never diagnosed. After a weekend of camping with his sons, he went to sleep and never woke up. The combination of some pain medication he had taken that evening and the sleep apnea killed him. He was 46 years old. My brother Fritz was diagnosed with lung cancer in 2014. He made it just past the Christmas holiday before he was gone. He was 54 years old. Besides the bond of family, my brothers had one thing in common. They never had health insurance their entire adult life. Not until it was too late, that is. There was no preventive care, no checkups, nothing to prevent the diseases from getting out of control. No treatment that could slow the progression of the illness because they were uninsured. My brothers worked all of their teen and adult life, often from sunup to sundown, yet insurance was not available to them. I believe that all people should have access to health care. I believe my brothers would be alive today had they had the preventive care that those with insurance are afforded, but it wasn't available to them. And that is why I fight, and I will continue to fight for health care for all. So that's why this matters to me. And now I'd like to hand it over to Amber to talk a little bit more about what your experiences have been with healthcare.
Thank you, Lisa, and thank you for sharing that information about your family. I know that's difficult at times. What I want is for all of you guys to possibly close your eyes or either contemplate these next two questions. And then on the third question, which is the last one, I would like for you to enter your answers within our chat box so that we have that information. Now, the first thing is, do you know anyone personally, or have you yourself struggled with getting access to medical health care? Because I know that's something that I have issues with, and I know I'm not the only one. What was that experience, not being able to have access to medical care, like, and what issues did you happen to face? How did this impact you mentally, physically, and financially? And what were your feelings about it? Now, this is what we would like for you to answer. Why is it important for everyone to have access to healthcare? What are your answers? How do you feel about that? And I will, while you're typing up those comments for the question, I will hand it over to Lisa Deal. Thank you.
Hi, everybody. While people are thinking
about those questions,
and give you an update about what we did at the legislative session this year. One of the things that we were very proud of doing is we had a lot of people show up. We had a lot of people who were there to meet with us, to lobby with their legislators, to attend events, and to generally get fired up about our healthcare agenda. Some of the wins we had this year included we cleared the IDD waiver list, which we have been trying to do for a number of years. And this provides home and community-based care for services for people with disabilities and intellectual disabilities. The legislature set aside $19.8 million to take care of the individuals that were still on that list. The other big win that we had was our dental coverage for Medicaid recipients. We're really proud of this win, and thanks to Lisa and the Circles campaign and many others, we were able to get Medicaid to provide dental coverage to about 300,000 West Virginians. So we should all be really proud of that and feel very good about all the people who are finally going to be able to go see a dentist. And we won the fight to reduce the copays for life-saving insulin. Some of you know that we had a bus that went to Canada this past year, and that really drew a lot of attention to the fact that many, many people cannot afford their insulin, their life-saving insulin. With the help of many of you, and hopefully many of you again during our 2020 legislative session, we can really make a difference on these legislative issues. And because of all of the work that everybody did, we were able to limit the copay for insulin to $100 a month, which is going to help thousands and thousands of West Virginians. Now, Kat, I think we're going to show, did we already show the healthcare poll? I'm having trouble visually here.
No.
I forgot one thing. Let me tell you this very quickly. We did defeat the work requirement for Medicaid recipients. It comes up year after year. We battle it down year after year. So we did a lot, but we're just getting started. And that's where all of you come in. As I said, we're looking forward to working with many of you during the 2021 session, and our health agenda is shaping up. So we want you to take a poll, and I think, Savannah, are you going to put up the sign for the URL? Okay, the URL is up. And just remember that if you take the poll now, you can win a $15 gift card. And now I'm going to pass it over to Kat. He's going to share some of our ideas of what we're going to work on next. Thanks so much, everybody.
And my computer is muted, and I have a terrible echo. Let me go back to that.
Okay, how do I sound now?
Much better.
Okay, so let's screw the phone. We don't need the phone. And thank you everyone for being here, and thank you to Lisa for sharing her story. Your family, much like my West Virginia family, has had a lot of tragedy, and I also will say that my family relies on Medicaid, and Medicaid saved my grandbaby's life, and I will dedicate the rest of my life to preserving Medicaid. So when you look at the West Virginia Health Agenda 2021, and we do have documents available on our website, Healthcare for All, but it's just a draft. It's just for you all to look at. We haven't finalized it. We're going to decide what we want to fight for and what's realistic in this very different year as we go forward. So we're going to really appreciate your input. One thing I will say is, we can't get anything done in Washington right now. There's a tremendous partisan gridlock. However, at the state level, I have seen more and more Republicans and Democrats working together. I won't say it's beautiful, kumbaya, but they are working together. And I think we have some opportunities at the state level to move forward initiatives to achieve affordable health care if in some different ways. So if we could go to the next slide. So just at the beginning of our health agenda, we really just outline how important Medicaid is to West Virginia. And I think most of the people on this call probably know this already. It serves a third of West Virginians. It brings federal money into our state that supports our rural hospitals and is critical to generating jobs and keeping our economy going, especially important right now with the COVID-19 economic hit. And it has been the critical tool in West Virginia for responding to COVID-19. I am very proud of our DHHR here in West Virginia. We have been a real leader state in changing policies so that it is easier for people to get on and no one gets kicked off, basically. That's probably not how they'd want me to say it, but there are no redeterminations during the period of the COVID emergency. So Medicaid, very important. Next slide, please. The other way. Oh, technology. I'm way too old for this stuff. The Affordable Care Act is also talked about at the beginning of our agenda. I think most of you also know how important it is to West Virginia. In fact, we are of all the states in the country, we achieved the greatest reduction in uninsured because we did the Medicaid expansion, and then with the premium subsidies in the market, and of course, this influx of $1 billion in annual federal money to support our rural healthcare infrastructure. And I also have to mention when I talk about the ACA, that it is protection against consumers who have a pre-existing condition like myself, like most of us, and that includes COVID-19. There will be a time when perhaps many more of us will have to deal with COVID. And after that, if we recover, and most of us will, God bless, we will need protection from pre-existing conditions. Next slide, please. So first and foremost, our health agenda very clearly states that we oppose any efforts in the state legislature to cut Medicaid. And secondly, it states very clearly that we oppose any efforts to repeal the Affordable Care Act. And I'll just mention now that we are asking West Virginia Attorney General Morrissey to remove West Virginia from the lawsuit before the U.S. Supreme Court asking for the repeal of the ACA. And I think you can see on your screen, West Virginia togetherformedicaid.com, not .org.com, one of those things, one of the curses I live with in life. And if you go there, you can sign our petition asking that Attorney General Morrissey remove us from this ridiculous lawsuit that would leave West Virginia with literally hundreds of thousands more uninsured people right in the middle of a pandemic. Next slide. Okay, with that said, we want to do more than just protect Medicaid and the ACA. Not that that's an easy lift, but we want to do more than that. We want to move things forward in West Virginia. Kind of ignore some of that stuff on that slide. I think when you go to the poll that Savannah is promoting, you'll see a way to score our 7 draft goals. It's really important. You should tell us if one of these is your most important. You should tell us what we've forgotten. Next slide. Okay, so let's go through these quickly. I don't have a lot of time. There is more detail available. I'll have my email at the end and our website. The first goal that we have, and we have 7 of them, so I'll go through them fast, is to create a children's health insurance choice program to close children's coverage gaps. And what that basically is, recognition of the fact that many of our kids in West Virginia still do not have health insurance. We're at about 90 to 93% insurance coverage for our kids, but every one of those children without health insurance is a child that needs to be covered. So we propose that you can buy into the CHIP program, the Children's Health Insurance Program, and that's going to be a great boon for those who cannot afford their employer-based coverage and their kids are still above income eligibility for CHIP, which is at well, I won't get into that. I'll stop myself. I'm such a policy wonk. Next slide. Our second goal is to create a Medicaid buy-in program to increase choice and improve affordable health coverage options for adult West Virginians. That's a mouthful. Basically, what we want to do is say you can get into a program just like Medicaid on the marketplace using your Affordable Care Act premium subsidies or premium tax credits. So this will give folks a more affordable option in our state marketplace for the Affordable Care Act. Some other states are also taking a look at this. So it's again a way to have more affordable options. Next slide. Expand Medicaid coverage to 1 year postpartum for women up to 300% of the federal poverty level. Well, as you can see on the slide, FPL 300% equals about $37,000 annual. Last year, as Lisa told you, we achieved an expansion of coverage for 60 days. We want to go for 1 or 2 years. We want to extend that. And particularly when you think about women who have substance use disorders who are in treatment while they're pregnant, you don't just cut them off that treatment 2 months after they give birth. We want to keep them in the program, keep the moms healthy so that the families can stay healthy, and particularly in the case of substance use disorders, continue treatment. Next slide. We will see goal 4. Last year, we expanded dental. And to me, dental benefit is really important if you're looking for a job. It helps if you can smile when you do a job interview. Well, it also prevents a lot of complications from dental disease. Now we want to take the next step and expand the vision care benefit for Medicaid-enrolled adults. And it's kind of shocking, but Medicaid does not pay for eye exams and glasses. It has some vision benefits in particular situations. But overall, if you just want to get your eyes examined and get those glasses upgraded, you can't do it on Medicaid. You have to pay for it out of pocket. This doesn't cost much. And it is really, to me, a real key to work and to parenting success and to taking care of ourselves. And I think because this doesn't have a real high price tag, we have an excellent chance of getting this expansion of a benefit, even in these times when our Medicaid budget may be hurting a little, if I can say it that way. Next slide. Our fifth goal is to regulate high prescription drug prices, something that the federal government has not had a lot of luck getting done, but there's actually a lot we can do at the state level. Last legislative session, we passed a bill that forces insurance companies and pharmaceutical companies to tell us how they price their drugs. And that information has to be posted online starting in July to the public, and it will be publicly available and updated every month. But that's not enough. That's just information. And information is a tool, and we can use that tool to take the next step and create a prescription drug affordability board. And that is a way that some states are going forward to start regulating the highest cost prescription drugs and those drugs with the highest price increases. And just want to mention, I don't know that folks realize that when the Kaiser Family Foundation did a survey of folks and found out that 1 of 4 Americans, with insurance or without, have trouble filling their prescriptions and go without prescription drugs. So this is a huge problem in our country, and one we can begin to address because Congress seems to be dithering around. Next slide. Our 6th goal is to enact paid sick and medical leave and paid family leave for West Virginia workers. Emphasis on paid. And this is pretty self-explanatory. We still have people who work hard in West Virginia who, if they take a day off work, they could be fired, they could lose their job, they could get a demotion, and they have a gap in their paycheck. And they may be taking off work to take care of a sick child. They may be sick themselves. Certainly with COVID-19, we understand the need for people can't afford to forego that paycheck. So this is paid sick and medical leave, and leave so that you can stay home and take care of your elders and your children without worrying about your budget. at least not as much. Next slide, please. The seventh and last goal, but certainly not the least goal, is improving how Medicaid addresses non-medical factors that impact health for Medicaid-enrolled families, sometimes called social determinants of health. But Lisa Deal and I decided we didn't like that term because who the heck knows what social determinants of health really means? We're talking about something that's common sense here. Housing, transportation, food, education, all of these things come together and influence how healthy we are. If we only do a pure medical model, treating disease, treating the problems, we are not going to improve our public health. We are not going to improve individual health. We have to start addressing housing and transportation, other issues. What we propose for the first year is to create a task force. And I don't ever get very excited about task force, and maybe some of you don't, but in this case, I think it's the right way to go. And we can look at some things that other states are doing. For example, we could have the managed care companies in their contracts be required to address some of these social determinants of health. For example, we could say that you have to provide air conditioning for a child with asthma, or you have to supplement food stamps so that people with diabetes can afford healthier food. Those are just some examples. We're seeing managed care in Medicaid managed care in our state do some of those things now, but we want to make sure that that is a sustained effort. So we'd like to create this public-private task force and start defining how we can do this in West Virginia. This would put us as a real leader state in the country. Next slide. Just skip over that one, actually. So there's one other thing I want to ask of you besides going to the poll that Savannah has been promoting, and that is to share your stories with us. I mean, I'm a policy wonk. I can dig into the policy and try to come up with solutions, but the most important way to change policy, the most important advocacy tool that we have is individual stories like you heard from Lisa, people talking about what it's like to be uninsured, what Medicaid means to them and why it's important, what has been your experience with COVID-19, what's your experience with problems with your insurance that you do have that's not public insurance. If you see, boy, it's hard to read on my screen. If you go again to West Virginians Together for Medicaid, it's all one word, WV togetherformedicaid.com, there is a place to share your story. And what happens is you don't have to, you can stay anonymous. You can tell us the details of your story or just give us your contact information. With your permission, a woman named Laura Foster will call you and talk to you about what it means to be part of our story bank and how your story might help us achieve our legislative goals. Excuse me. Next and final slide. I just want to say thank you for letting me be part of this. The folks on this call did a lot of hard work to make this happen. But most importantly, I hope that everyone will be safe and healthy out there. Wear your mask, do your social distancing, and let's not let that become a political issue. Let's let that be a public health issue. Thank you.
Great. Thanks so much, Kat, for that overview. And there was a lot of stuff in there, but it's a lot of good stuff. It's stuff that makes me feel really excited when I think about the possibility that we could provide eyeglasses and vision care for everybody in West Virginia who needs it, including people who can't afford it on their own and are on Medicaid. The possibility to cover moms who are in recovery for the full length of their recovery from pregnancy. The possibility of being able to use some of this Medicaid money to really address those root causes of why we're unhealthy, like dealing with education and access to healthy food. So thanks, Kat, for identifying all those opportunities. I think we're all here because we're really excited about the potential for what we can change at the state level. It's stuff that a lot of us didn't even know we could change. And that's why we're here today, is to talk to you about it and try to get you excited too. But we also want to hear what you think. So one more time, I'm going to push this poll, and it may also appear on your screen, tinyurl.com/H4A poll. The H4A stands for Healthcare for All. Take the poll. There's going to be a drawing at 7:30 for a $15 gift card. And we want to know what you think. So you'll see on that poll some of the issues, all of the issues that Kat brought up, which are things that we could be working on. And we want to know which of those things, are those the right things to be working on? Are those things that you're excited about, and which ones are most important to you? But we also want to know, what are the things that are going to make you healthy? Kat used the word social determinants of health, but that just means, like, what is it in your life that decides whether you're healthy or not? Because those are things we need to consider as we decide how to invest our money. We need to be focusing on preventative care. So we want to know that from you when you take the poll. And we also want to know what the other things are that you want to see change. So what are we missing? And I know that there are things that we're missing that we can change at the state level. So take a minute to do that poll. One more plug. We're not going to be able to look at results tonight, but we will look at them, and we'll do that drawing at 7:30. And with that, I'm going to hand it off to Amber, who's going to talk about one last ask for you all.
Thank you, Savannah. I completely appreciate you putting it out the poll, because it's very important. So please, 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 one more time, take the poll for us. It's tinyurl.com/H4A poll. One more thing is that one person can make a difference. Many people can make an impact, and that is what we're working towards. And we challenge you to join us. You can volunteer your time. You can do things with us by contacting, doing phone banks, going to the Capitol, and which I have been a part of myself, as many of us have that are on the panel today. And it is a great time. You get to meet all of our legislators and just be there and support everyone and all of West Virginia residents. So you can join us or say what you would like to do by going to www.healthcareforallwestvirginia.com/join. So I hope that we get many of you to be involved. And at this point, I will hand it over to Lisa Doyle. Thank you.
Well, thank you, Amber, and thank you to all of our panelists, and a special thank you to those who have tuned in this evening, whether it be via Facebook or via the platform we're currently using. I do want to share one of the comments that was in our chat box with the group. And this came in from Jessie Ice, one of those helping us out this evening, and she passed this forward. And she shared the comments: I do not have health insurance because I made $75 a month too much last year. If I pay the $400 a month that's needed to join the health insurance club before deductibles and co-payments, then I will be underneath the poverty level. That is not my goal. I want to make more money so I can take care of myself, but like we all do. Unfortunately, the states use the federal poverty guidelines for their Medicaid cutoffs. This is different for every state, and it should not be federal. Thank you for sharing your stories. My heart goes out to you all. So thank you for that person for sharing that personal story of how there is those coverage gaps. And that's why 2 of our platform items are dedicated specifically to covering those gaps, both for children with the CHIP buy-in and for the adult Medicaid buy-in. So we appreciate you sharing that and giving that perspective on why healthcare is important. So I want to thank all of our panelists this evening: Savannah Lyons, Lisa Deal, Amber Roberts, Kat Stoll. And we really appreciate your dedication to inspiring others across the state of West Virginia to get involved. Because as Amber said, one person can do so much, but when we all work together collectively as a group, we can accomplish major feats. We can move mountains. Since we do have about 15 minutes left, I do want to go ahead and just quickly run through what those platform items were and encourage you to go on and take the poll. Give us your opinion on, which one of these is most important to you as a West Virginian. Your opinion matters. So going through those items briefly, the first was to create a children's health insurance program, buy-in program to close children's coverage gaps. The second was to create a Medicaid buy-in program to increase choice and improve affordable health coverage options for adults in West Virginia. And that would assist so many of the what we call the working poor that are just above the coverage guidelines, but unable to afford the insurance available in the marketplace. The third was to expand Medicaid coverage to 1 year postpartum for women up to 300% of the federal poverty guidelines. The next was to expand the vision care benefit for Medicaid-enrolled adults. And to me, this is such a no-brainer, that platform item, because I work with so many families through the Circles campaign that are in poverty or are low income. And clearly, I think of one of our Circle leaders, Joe, who was so excited after 8 years to be able to get a pair of glasses. I think of how blind I am without my glasses, knowing that if I did not have them, there's no way I could go to work. There's no way I could see to drive. There is just no way I could maneuver life without my ability to see. So to help make people, more employable and to have a better quality of life, people need vision. This is the 21st century, so this is something that should be available to all. The next fifth platform item was to regulate high prescription drug prices and increases to save money in the PEIA and Medicaid. So regulating prescription drug prices. And as Kat so eloquently pointed out, 1 in 4 Americans can't afford to buy their prescriptions. Therefore, they're going without those needed medications, and therefore their health is not going to improve, but just go downhill. The sixth platform item was to enact paid sick medical leave and paid family leave for West Virginia workers. And the seventh item was to improve how Medicaid addresses non-medical factors that impact health for Medicaid-enrolled families. So again, I encourage you to take the poll, and there will be a drawing for those that have completed the poll during this town hall. And there will be a video available if anybody wants to go back and share this town hall with others. I know this was our very first town hall, so we are working through the bugs, the technological issues. We appreciate your patience and bearing with us, but if something in this really struck a chord with you and you want to go back and share, you certainly can. We invite you to do that. And we also invite you to become involved with the Healthcare for All campaign by volunteering. And there are so many things that one can do. And it can be as simple as writing your congressman. It can be as simple as making a phone call. It can be going to Charleston to talk to your congressman or senator. It can be collecting stories of others that maybe were impacted like you have been. So thank you again to our panelists, and thank you again for joining us. And I will turn it over to Savannah to see if she has any last comments to wrap things up, or any updates on some of our poll responses.
I just want to thank everyone for sticking with us, and I want to thank everybody who's been in this big learning adventure of a virtual town hall with us. We're learning as we go, and every single one of us is here because we are personally passionate about the change that we believe is possible, and because we have experienced firsthand ourselves what it feels like to be able to make a change, to be able to wake up one day and know that 300,000 adults have dental coverage through Medicaid because of the advocacy that we did, or other things like that. So, I hope that our passion shines through, and I hope that you'll get involved with the Healthcare for All campaign and coalition. And just want to thank everyone again. And I think we're ready to wrap up. So appreciate you and have a great week.
Family alone. It is happening to West Virginians and Americans all over. I do want to say that the fact that my brothers are no longer here is proof that the lack of access to healthcare kills. I shared pictures about, where my brothers were, things that we were doing, life in action. But now I want to share a picture of where my brothers are now. And this is my brother Bob, otherwise known as Joseph. He's buried at Mount Carmel here in Parkersburg, West Virginia. This is my brother Scott, 46 years old, died of sleep apnea. How is that even possible? It's possible because he had no preventive care. He's buried in Sandfield, North Carolina, at the Berea Baptist Church Cemetery. This is my brother, Fritz, Timothy. He was cremated, and this is where he is. His ashes are still in a cardboard box to this day. So there is no question that the lack of access to healthcare kills. So please join our fight. Campaign with us, beside us, and for others, so that everybody can live their best life.